Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we talked about psychology and memory. In this video, we're going to talk about developmental psychology. Before we get into this video about developmental psychology, I just want you to know a couple of things. If you are planning a career in teaching or being a paraprofessional, you'll need to take developmental psychology in college. If you're considering social work, nursing, or you're going to be a medical doctor, you'll also need to take developmental psychology in college. Developmental psychology is defined as the scientific study of how human beings change from conception through childhood, adolescence, also called the teenage years, adulthood, and through the death process. Developmental psychology observes and analyzes the physical, cognitive, and psychosocial development through the various stages of life. When developmental psychologists are studying the physical development of various life stages, they look at how the body grows and changes, specifically within the brain as well as within the movements of the extremities and trunk of the body. The cognitive forms of development that developmental psychologists analyze include attention, memory, learning, language, creativity, reasoning, and many others. The last category these psychologists observe and analyze are the emotions, social relationships, as well as the personality of various ages of people. It has not been easy to study and define whether human growth happens in sequential stages that can be seen around the world with all people, or if different cultures define what these stages are. The normative approach to psychology looks at different age groups and then has to decide what a normal range of cognitive, physical, and psychological social growth consists of. Essentially, what are the milestones of each age group and how do these researchers decide whether or not these milestones have been met? Developmental psychologists that believe in stage theory believe that the stages of development and growth are universal for all people. As an example, they believe that all human beings begin to learn to talk at about the same age. All children first babble and will then eventually say their first word. What role does genetics or the environment play in this developmental growth? Developmental psychologists call this debate about how much genetics influences a person's growth process versus the influence of the environment as nature versus nurture. Nature refers to a person's biology, or essentially their genetics, whereas nurture is defined as the environment that a person grows up in, or their culture. Sigmund Freud is one of the first psychologists that's talked about in developmental psychology. He created the psychosexual theories of development and believed that children's personalities were developed within early childhood. Freud believed that development was discontinuous, meaning that each child had to go through a series of steps before they could move on to the next set of steps and progression. Freud's psychosexual theories of development highlighted the oral, phallic, latency, and genital stages that he believed each child had to go through in order to become an adult. Most professors won't spend a ton of time on Freud because his theories cannot be scientifically proven through experimentation. The reason he's highlighted is because he's one of the first individuals to discuss his views concerning children and their growth process. Erik Erikson is another psychologist that will be discussed in developmental psychology. He created the psychosocial theory of human development. Erikson believed that personality was a lifelong process and that through interaction with others that we create an ego identity. Erikson's psychosocial stages of development include 8 different stages. In each of these stages, an individual has a challenge that they needed to overcome. If they were able to master the challenge, they would move on to the next stage. If they didn't get through that stage, they would stay stuck in it. Modern developmental psychologists really like Erikson's theory, but they don't believe that people have to stay stuck in a stage if they can't move on from it. They believe that people can jump around in their stages and develop skills as they go. This theory, or his theory, is generally studied in depth when a student decides to become a public school teacher. In the first stage of Erikson's psychosocial development, this stage is called trust versus mistrust. From 0 to 2 years old, a child seeks out trust with their caregiver. When a child cries and their caregiver comes to appease them or give them what they need, like a bottle, the child develops trust. If they're neglected or their needs are not met, this develops mistrust. In the second stage of psychosocial development, this stage is called autonomy versus shame and doubt. This takes place when a child is a toddler. If a child is given the opportunity to explore and the caregiver praises this, the child begins to feel autonomy. If a parent attempts to hold back that exploration or tells the child that they shouldn't touch this or that, the child can develop shame and doubt. The next stage generally begins in preschool. This phase is called initiative versus guilt. Generally, when a child can try on different roles like pretending to be a shopkeeper or a scientist or a doctor, the child is taking the initiative to explore different roles. If the child's told they cannot be or do something like perform scientific experiments, the child feels guilt and feels they cannot do something. During the elementary school years, the stage of development is called industry versus inferiority. It is in the elementary school years that children begin to notice what they're good at. Feeling a sense of being good at a subject like math or reading gives a child a sense of industry. If they can't find something to be successful in, they feel inferior. The next stage occurs during adolescence. This is when teenagers often try on different identities. Maybe they feel like they're an intellectual or an athlete. This is when a person really begins to feel a sense of self. If an adolescent doesn't feel a sense of self, they'll experience a feeling of isolationism. The next stage takes place during early adulthood. The goal is to achieve intimacy through either a relationship or through some sort of friendship. In middle adulthood, the stage is called generativity versus stagnation. This is usually when an adult has been in their career for a certain period of time and begins modeling or being a role model to younger people. If an adult in middle adulthood has had to start their career over or doesn't feel like they're connecting with their career, this may lead to a feeling of stagnation. The last stage takes place in older adulthood. This stage is called integrity versus despair. When a person reaches the last stages of their life, if they feel pleased with the way their life has gone, they'll feel integrity. If they don't, they'll feel regret and despair. Jean Piaget is another developmental psychologist who examined the cognition of children and their growth. Piaget's work is limited in that he used his own children to develop his theories about childhood cognition, but there's still value in this theory. Piaget believed that cognition and its stages were sequential, and in order to move to another stage, a mastering of a cognitive process had to be completed. Piaget noted that as children learn, they create schemas. Schemata are defined as concepts that are used to help categorize and interpret the information that's presented to us. As children grow and develop, they continuously add more information to their categories as well as create more categories for their information. As children learn, they can shift their schemata by using two different ways, assimilation and accommodation. Assimilation means taking in the information and placing them into already existing categories. Let's say you have categories such as animals, humans, and vehicles. If children learn about rabbits, semis, and a new uncle named Robbie, assimilation means that they can take these three new items and put them into categories that are relevant. Accommodation is when new information has been introduced and the children have to add new categories or shift the ones they already have. Let's say a child has only seen dogs all his or her life. When her mother takes her to a friend's house, a cat appears in the living room and the child says dog. The mother corrects the child and says cat. The child will probably give the mother a strange look and then look back at the cat to see what is the difference between a dog and a cat. Maybe at this point they realize that a cat has a long tail, pointy ears, and meows. If they recognize this, a new category for four-legged creatures might be cats. Let's take a look at Jean Piaget's 4 stages of cognitive development. The first stage is called the Sensorimotor Stage of development. This stage takes place between 0 to 2 years of age. It is during this stage that an infant learns about the world from their sensations and movements. One of the strongest sensations that they learn through is by sucking on items or putting them into their mouth. The mouth is extremely nerve sensitive and it can serve as a means of touch or learning about something. Infants also learn about their environment through observation through their sight, listening, and attempting to grasp something when they get old enough. This is also the stage that infants learn about object permanence, which is around 7 to 9 months of life. Let's say you have a toy or an object, and you show that object or toy to the child, and then you lay it under a cloth or inside a box. An infant who hasn't achieved object permanence would believe that the object just doesn't exist anymore and might move on to something else to explore. Once the infant has reached object permanence, they'll attempt to lift the cloth or get inside the box to find the toy or object. This is when a child can achieve separation anxiety from a parent as well, because the child recognizes that their parent or caregiver is going somewhere else without them. The next stage is called the preoperational stage of cognitive development. This takes place from the age of 2 years old to 7 years old. This is when language takes off really quickly and children recognize that words can be symbolic of objects or people. Children are egocentric at this stage and cannot see that other people have perspectives. This is when the imagination is at its peak and children don't understand conservation, which means concepts like mass and volume. There is a famous experiment that people use at this stage. If you take 2 glasses of water and fill them with the same amount of water and ask a child which one of these glasses has more water or are they the same, children at this age will state that they're the same. Now, if you take one of those glasses and get a different size shaped glass and pour that same amount of water into that different size glass and then ask the child again which glass has more water, they'll tell you that the one that's shaped differently will either be larger or smaller depending upon its shape. In this stage, children are really conceptualizing based upon their concepts of large or small. They're not really looking at the multi-dimensional facet of volume. The next stage is known as the concrete operational stage, which goes from 7 to 11 years of age. This is when children begin to think very logically about the world around them. They do begin to grasp conservation, including mass and volume. This is also when children begin to recognize that other people have feelings and thoughts that are different from their own. They're no longer as egocentric as before. Children at this age think more literally. They still have an imagination, but even their imagination tends to be more logical. The last stage of Piaget's cognitive development theory is known as the formal operational stage. This stage begins around 12 years old, but can vary per child. This is when a child can begin to think abstractly or hypothetically about different scenarios. They're not as logically driven as they were before. They tend to question moral, social, political, and justice-oriented scenarios that they did not before. They get better with deductive logic and can draw up different solutions to various problems. Lev Vygotsky is another psychologist that is covered in developmental psychology. Vygotsky was Russian and determined that human development could come directly from a person's culture. He was the first psychologist to look at growth and development in this way. This is why Vygotsky is often brought up in nursing tests as well as psychology and educational exams. You're going to hear the term ZPD, which means the zone of proximal development, meaning that what a child learns is directly related to those individuals and the environment that directly surrounds the child and their potential movement. A culture is especially important for a child's growth because this is where they're introduced to language and cognition. Just like Vygotsky highlighted culture, Lawrence Kohlberg focused on the moral development of human beings. Kohlberg is brought up quite a bit in testing. Sometimes tests just want you to match the name Kohlberg with moral development, and other times they want you to know his specific stages of moral development. Lawrence Kohlberg believed that moral development came in stages with human beings. He studied moral development by asking people hypothetical questions and asked for their reasoning for their answers. Then he created different stages of moral development based upon people's reasoning. The first stage was called Preconventional Morality, and this happened before the age of 9 years old. In this stage, morality is generally determined by a child's will to be obedient and avoid punishment. At first, the child will attempt to avoid punishment, and they'll eventually create a self-interest in gaining rewards. The second stage is called conventional morality, which happens in early adolescence. In this stage, moral development is driven by positive approval on a social level. At this point, children tend to develop morality by learning to obey authority figures and conform to the social rules around them. Now, stage 3 is called post-conventional morality, once formal operations have been attained. In this stage, individuals recognize there's an agreement between human beings to follow rules and laws in order to bring about a social order and individual human rights. To reach the highest stage of moral development, people internalize a want to be good and follow the constructs agreed upon by society. They understand not only do they have individual rights, but that all human beings have their own individual rights. Not everybody reaches this stage of moral development. In developmental psychology, the basic stages of pregnancy and prenatal development are covered. These are broken into 3 stages: germinal, embryonic, and fetal. The germinal stage is the first and second week of pregnancy. During conception, the sperm fertilizes an egg, a zygote is developed. A zygote is defined as a fertilized egg. In the sperm is the biological father's DNA, and inside the egg is the biological mother's DNA. Once the union is made between sperm and egg, the genetic makeup or the DNA is placed. In the first week of the union, the single fertilized cell divides and multiplies. 1 divides to 2, then 2 to 4, then to 8. This cell division is called mitosis. Less than 50% of fertilized eggs make it beyond the first 2 weeks of life. Within 5 days, 1 single cell has divided into 100 cells. When a baby is born, generally 9 months later, the infant will have billions of cells. When the division of the cells take place, different body parts as well as organs are formed. Once the zygote is able to move from the fallopian tubes and implants itself into the lining of the uterus, the next prenatal stage begins. When the zygote implants itself into the lining of the uterus, it is officially called an embryo. This stage is called the embryonic stage, which takes place between 3 to 8 weeks of pregnancy. Once the embryo is implanted, blood vessels will begin to grow, creating the placenta. The placenta is a connection between the uterus and the embryo, which provides nutrients and nourishment as well as oxygen. It's within this embryonic stage that the head, trunk, and basic structures of the body will develop. The heart will also begin to beat. Various organs will form, and specifically the brain and spinal cord will develop. The third week is known as the fetal stage, which begins around 9 weeks until labor and delivery take place, which is about the 40th week. This is when the embryo is officially called a fetus. At 9 weeks old, a fetus is the size of a kidney bean. It is during this stage that the sex organs will develop. At about 3.5 to 4 months, the fetus is usually 4.5 inches long. It will develop fingerprints and extremities will continue to grow. By the time the fetus reaches about 24 weeks old, it will weigh about 1.4 pounds. The fetus can now hear sounds that are coming from outside the womb. A little after 23 weeks, a fetus born prematurely may be able to survive. It is important for the fetus to stay inside the womb as long as possible, in that it takes 40 weeks for a fetus to develop fully. In the last many months of pregnancy, a fetus and its brain will continue to grow. Its extremities will lengthen and its lungs will take time to mature. Medical professionals generally are reassured that a fetus has reached an adequate amount of growth if labor begins at 37 weeks. On average, newborn infants will weigh about 6 pounds and will be about 18.5 inches long. It's really important that a pregnant woman be very careful about what she eats during pregnancy and be aware of the medications that she's taking. A majority of what the mother eats and takes can move across the placenta, so whatever the mother ingests or inhales, the fetus will also be impacted. It's very important for a pregnant woman to get prenatal care. This can decrease the chances of things going wrong at birth. Pregnant women will be given prenatal vitamins to decrease the chances of birth defects and problems. Folic acid is especially important for pregnant women to take. A teratogen is known as any type of chemical or environmental agent that's consumed or inhaled by a pregnant woman that can cause damage to the developing embryo or fetus. There are many different types of teratogens, including alcohol, medication, cigarettes, diseases, and even a lack of nutrition. Women who drink alcohol during pregnancy may give birth to infants with smaller head sizes, skin folds in the corners of their eyes, shorter noses, and problems with the lips. If way too much alcohol has been consumed, a child can be born with fetal alcohol syndrome. Those born with FAS will oftentimes have learning disabilities and are at risk for dropping out of school. Smoking during pregnancy can cause low birth weight, can reduce the oxygen to a baby, and increase the risk of sudden infant death syndrome. There's also a higher risk of these babies being stillborn. Drugs such as cocaine, heroin, and meth also cause a host of problems. These babies are often born addicted to the drugs and have to be weaned off of them. Okay, there's a couple other topics that are covered in developmental psychology courses. Remember, a developmental psychology course is a full semester, if not longer, so this is only an overview of items that might be covered. Attachment is another issue that will or should be covered in a developmental psychology course. Attachment occurs when there's a connection or bond with others, as children learn to interact with others, form relationships, and manage their own feelings. Harry Harlow and Mary Ainsworth were two psychologists that examined the issue of attachment. Now, Harry Harlow studied attachment by using rhesus monkeys as his participants. Harlow conducted his experiments in the 50s and separated baby rhesus monkeys from their mom. These baby monkeys were then introduced to a choice of two mothers. Both mothers were fake, but one was made of wire, and she held a bottle with milk in it. The other mother was covered in terry cloth, was also wire, but was more soft and cuddly. Harlow believed that monkeys would prefer the mother with the milk, as this would allow the baby monkeys to grow and thrive. He was quite surprised when the baby monkeys spent most of their time with the cloth-covered monkey and as little time as possible with the wire monkey. This showed Harlow and others the importance of emotional comfort with infants. Many of the monkeys, when introduced to items they found scary, would run to the cloth mother for comfort and a feeling of security. Mary Ainsworth also studied the issue of attachment, and she created the strange situation procedure to study it further. This study took place in the 70s, and the mothers and their infants were asked to sit in a room with toys by themselves. After a certain amount of time, a stranger would come into the room, and then the mother was asked to leave. The baby was left by himself or herself, and after a couple of minutes, the mother would come back into the room. When Ainsworth conducted these experiments, she found that there were three types of attachments: secure, avoidant, and resistant. Later, she added disorganized attachment. Ainsworth felt that secure attachment was the healthiest reaction from the young babies. This she described as the baby preferring the parent over the stranger, and the baby sees the mother as an attachment that he or she can use to explore the room and the environment around them. When the baby is stressed, they seek out this attachment. These babies show distress when their caregivers left the room. When the caregiver returned, the baby was very happy to see them. This type of attachment showed these caregivers to be responsive and sensitive to the needs of their babies. In the second scenario, Ainsworth called this avoidant attachment. This meant that when the parent left, the child did not react to it. The child did not explore the environment with the safety of the caregiver. The child then acts kind of the same way to the parent as they do with the stranger. When the caregiver came back, the child really does not react. Ainsworth believed these caregivers tend to be more inattentive and insensitive to the needs of their child. In the third case, Ainsworth called this resistant attachment, meaning the children were clingy but didn't emotionally react well to the caregiver when they attempted to give them attention. The baby does not interact with the toys around them, and when the parent leaves the room, the baby becomes angry and emotionally acts out. When the caregiver comes back, it's difficult to get the baby to calm down. Ainsworth believed that these caregivers inconsistently met the needs of their children. Disorganized attachment was later described as behaviors from the infant that were strange. These children would sometimes run around the room or try to run from their own caregiver. Ainsworth believed that these children might have experienced abuse. Abuse makes it extremely difficult for a child to regulate their own emotions. Ainsworth did acknowledge that a child's temperament might influence the attachment of the caregiver and the infant. The last item that we're going to talk about is parenting style, which was discussed by Diana Baumrind, who studied children's socio-emotional growth. She listed 4 different parenting styles: authoritative, authoritarian, permissive, and uninvolved. Authoritative parenting is present when the caregiver provides rules but explains why those rules are in place to the children. These caregivers are warm, affectionate, and listen to their child's point of view. These caregivers will make exceptions to the rules if there's a case for this extension. They attempt to guide their children to learn to make good decisions. These children usually have a higher self-esteem and communicate really well. Authoritarian parenting takes place when caregivers demand obedience from their children. Everything that they're saying and their rules must be followed. These children are monitored and regulated very strictly. The rules are not ever flexible for these kids. Oftentimes, these children tend to be really unhappy, almost anxious, and withdrawn. Permissive parenting is when there are few rules for children and they're allowed to do pretty much whatever they please. There are few demands put on these children. These caregivers are very loving, very nurturing, but sometimes the parent plays the role of the friend instead of the parent. Sometimes there's no bedtimes at all. These caregivers lack self-discipline and are extremely permissive in their parenting style. These children can have bad grades because their parents don't often stress the importance of the grades. Sometimes these children can be at risk for alcohol use or risky sexual behavior. These children can have higher self-esteem, better social skills, and less depression than other children, though. Lastly, uninvolved style of parenting is when caregivers tend to be indifferent, uninvolved, or even neglectful. They don't respond to the needs of their children. These parents can be obsessed with their own work, be dependent upon drugs or alcohol, and have bad depression or other mental health issues. These parents make sure their children have enough to eat, drink, clothing, etc. They just tend to be emotionally withdrawn. This can create children who are also emotionally withdrawn, fearful, have a higher risk for alcohol and drug abuse, and may perform really badly in school. Well, this is the end of our video. I wasn't sure whether or not to cover this material, but I think it's important for those of you that are going into healthcare, education, or social work. I hope you enjoyed the video, and please remember to subscribe to the channel. Hope you're doing well and have an amazing day.